Okay. Well, thank you very much. It's a pleasure to be able to present some material to you this morning. I want to point out before I start that Larry and I did not coordinate on our slides, but I think we're going to, talk of two sides of the same coin, and that is data transparency. Larry has covered making information available between providers, between healthcare organizations, and even the public. I'm going to talk about it from a patient lens. And Larry also chose to start his talk off by talking about a law that Congress passed. And so I will do the same. My law is in 2016. This was a law passed by the United States Congress called the 21st Century Cures Act. And it was designed to encourage data transparency in multiple ways, not just with patients, but between healthcare organizations and even insurance companies. And those latter two we won't talk about this morning. But what it did is it made something illegal called information blocking. Now, it didn't say what information blocking was. The concept was, though, that we needed to be able to share information for the good of our patients. Now, the ONC, the Office of the National Coordinator, which Larry mentioned in his talk as well, issued a 1,200-page rule in May of 2020 that clarified what information blocking was and has driven a lot of our more recent efforts on data transparency. But what I want to tell you is kind of the journey of UCSD in making information available to our patients, not only because we wanted to do this, but because we knew this legislative mandate was there in the background. So what is the strategy? Well, we've had an enterprise electronic medical record for quite some time. We went live with Epic as our vendor. I believe Larry in primary care back in late 2005, 2006. And we went live in the hospital in 2011. We've had an integrated system for quite a long time. And that system also has a patient portal, a patient-facing view into the medical record called MyChart. And we've had MyChart for a number of years. And so our first strategy was to aggressively encourage adoption of that patient portal and to display and enable as much functionality within it for patients as we could. Now, I won't talk this morning about telemedicine. Larry covered that very well. And most of those telemedicine visits on the patient side are done via MyChart. And so even though we've been encouraging adoption for quite some time, we've seen even more adoption of MyChart during 2020 for telemedicine reasons. And we now have, I would say, greater than 500,000 active users on MyChart within the organization. Next strategy is that we also want to pursue something called open notes, and I'll talk about the open notes movement in a moment, but this involves making clinical notes available to patients in MyChart. We wanted patients to be able to get a copy of their electronic medical record using MyChart, and although you can display a great deal of information in the portal itself, there's more information in the legal medical record and the designated record set. And our patients can now make a request of our medical records department for a PDF of their full medical record, and they can get that turned around generally in 24 hours. Our HIM department tells us that they get between 500 and 1,000 requests every month for this from patients. Patients love the functionality and they take advantage of it. Epic did develop the ability for patients to actually share their records with other doctors outside of our organization or outside of the healthcare organizations that use Epic as their vendor. And I'll talk about that a little later. The patient portal also has an inpatient version, and we have installed that for hospitalized patients so that somebody who's in the hospital can see their vital signs and their lab results and other information relevant to the care that they're receiving in real time. And as was mentioned at the outset, and was something I talked to this group about a couple of years ago, we want to integrate MyChart with other third-party platforms so that patients have control over their discrete data. And we did this with the Apple Health Records platform a number of years ago. We are in the works in doing this with Common Health, which is another platform, and I'll talk about that in a moment. So MyChart. Well, this is our electronic health record patient portal, and this is the way patients get things done and the way they get information. We have adopted a number of strategies to push MyChart. In every clinic visit, a patient gets an activation code so that if they are not signed up for MyChart, they can self-sign up using that code. We've allowed clinic staff and registration staff to sign patients up on the spot when they present to our clinics. This is, of course, before COVID times when most care was in person. We've also been, ever since the mobile app version of MyChart has been available, we've been pushing that strongly, even embedding it in a UCSD health app that our own folks have developed and made available for our patients. One last thing in this strategy lens is that we don't yet have the ability for patients to sign up for MyChart if they're not yet a UCSD patient. If they've got a medical record number and they've been seen, we have lots of ways to do it. However, we do want people to be able to sign up and have a MyChart account before their first appointment. And we are working on that workflow and expect to have it ready very, very soon. We show lots of information in MyChart, and I won't give you a patient example, of course, for PHI reasons, but we show medication and allergy lists, problem lists and diagnoses, information on their appointments, their patient instructions from prior visits, their immunization record, their health maintenance screening, what's due, what's overdue, labs and imaging results, and very recently, clinical notes. Patients can get quite a lot of information in MyChart that constitutes the majority of their medical record. And this is, I think, has been very, very successful. And although I want to applaud Dr. Friedman for kind of leading the efforts to, with physicians say data transparency is a good thing. There's always a few physicians out there who think that, well, the more you tell patients, the more they're going to ask me questions and occupy my time. That really is not the case and has not been borne out by our own data. Last thing I'll say about MyChart is that we actually recently have made it available to all of the health system employees at UC San Diego, and we are going to be using MyChart-based workflows. We are already using MyChart-based workflows this week to get our employees scheduled for COVID-19 vaccinations. This is our second day today of doing this, and the process actually works quite well. We're very excited about being able to use this platform to get people the 2 appointments they need for the 2 vaccinations for COVID-19. So one nice thing about Epic is they give you a lot of dashboards. And so we've had tracking data on MyChart for quite some time, and I'm just showing a few things here of the types of data we can get. We know fairly reliably that in-person visits, we know that we're activating over 60% of our patients when those opportunities arise. The same-day activation rate is around 5 or 6%. It's going to be low because a lot of our patients are already on MyChart and the opportunities aren't enormous every day, but we're getting a few people every day, which is great. In terms of lab results in the bottom graph, since some of the changes went live under the 21st Century Cures Act, people are now getting about 90% of their lab results within 24 hours. In many cases, within 8 hours of the test result being available. So what about notes? This has been a big movement in the last few years, and it's not new, and it wasn't even new when the 21st Century Cures Act was passed. It predates that. But this is the idea that being transparent with clinical documentation with patients actually is a patient benefit. And there's now a robust literature on open notes. It has been fairly well demonstrated that, one, on the patient side, patients have a better understanding of their care plan and a better engagement with their health system and physician if their clinical notes are shared. And on the physician side, as I said earlier, a lot of people think that if you make notes available to patients, what happens is that lots of questions get asked, care becomes inefficient with that relationship. And surveying physicians who have gone live with open notes show that that is not the case. It's actually not disruptive to workflow and actually has benefits on their side as well. So we went on our open notes journey back in 2018, and we started sharing clinic notes from primary care areas, internal medicine, family medicine, geriatrics, by default in the summer of that year. We made everyone else able to share notes, but, and the literature on open notes does bear this out, if you make it available, but you require providers to opt into sharing, you don't get a lot of sharing. And we had some, but not a lot, and our experience was consistent with that. So what we did this year, kind of driven by the 21st Century Cures Act and the desire to make more notes available, is that we set up everyone to share by default. And that would be both in the clinic and the hospital setting. And we are now seeing many more notes shared with patients, and I'll show you some data on that. We are sharing over 40% of all our notes. Now, when you think about notes, it's not just provider notes, not just physicians, but also nurses and case managers and social workers. And so right now we're sharing physician notes, and we are working over the next couple of months to expand that to some of our non-provider clinicians like therapy services, care coordination, and nutrition, so that those notes are shared as well. If you pull data on some of our outpatient specialty clinics, and here I'm just showing examples from orthopedic surgery, cardiology, and cancer, when we made that change to share by default, which happened just about 6 weeks ago, the tracking data for November shot way up, and we're now sharing over 60% of our notes in most areas, and in primary care, that number is even higher. So that's the outpatient side, and MyChart is the workhorse application that we use to get data to patients. What about the inpatient side? Well, as luck would have it, in 2016, we were building a new hospital. This is the Jacobs Medical Center. It went live in November of that year. And one of the things that we did is we put plans in place to put iPads in every room in that hospital. And so if you were admitted and you ended up in a bed in Jacobs, you would have an iPad at the bedside. And much of what was on that was patient experience related. So there were room controls, like controlling the lights and thermostat and other things in the room, controlling the television, apps on the iPad for patient engagement like Netflix and Hulu and things like that. But we also went live with Epic's inpatient patient portal called MyChart Bedside. So MyChart Bedside was made available on all of those tablets. And we had several patient populations that were very invested in this because we'd done a few small pilots, particularly with our bone marrow transplant group. And bone marrow transplant patients, for reasons that are probably obvious, are extremely interested in their vital signs and their lab results every morning, particularly around their cell counts. And so there was enormous adoption amongst this population. We also had, by virtue, I think, of the fact of our chief information officer being a practicing pediatrician, a lot of adoption in the newborn nursery, the postpartum, and the NICU areas. So we put MyChart Bedside on these tablets. We made it available. And what this allows patients to do is see a great deal of information about what's happening all around them. So they can see their daily schedule, when are medications due, when are imaging tests going to happen. They can see their vitals and labs. They can see their care team. Who are the people taking care of me? Not just the attending physician, but any residents or advanced practice providers, their bedside nurse, their case manager, along with photos of all of these people, because we uploaded photos for every user into the system. And we strongly encourage people to write a small blurb about themselves in Epic so that patients could see that in MyChart Bedside, a little bit about me. And just talking about that reminds me that I haven't updated that in about a year, and I should probably go do that. This started in the Jacobs Hospital, and part of the benefit of the iPads was certainly the fact that we could integrate room controls and do other things, but we did expand tablet availability to our other inpatient sites over the next year and a half after that hospital went live, and MyChart Bedside is now available everywhere at both of our campuses and all of our hospitals. It had an added benefit this year during COVID, as we were able to also spin up some Zoom-based inpatient telemedicine workflows. Back in the spring, when things were moving very quickly and there was a lot of uncertainty around patients in isolation and risk of acquiring COVID from patient care, a lot of our physicians wanted to only do some of their visits in person, not only because of the COVID concerns, but also because we wanted to save personal protective equipment to the degree that we could for required use. And so we put Zoom on all of these tablets, and this allowed providers to have conversations with patients remotely, but still engage in care. Some things we've done over 2020 to augment this are we have integrated a third-party vendor translation service called Marty, interpreter service, so that patients who are non-English speaking can still get telemedicine care in the hospital space. We've also allowed this Zoom calls to be initiated by patients so that they could contact their families or their friends because our visitor policies have been fairly restrictive. during the COVID pandemic this year. So we wrote up, after we went live in Jacobs, we wrote up this experience in terms of the inpatient patient portal and having consumer engagement applications on it. Being a driver of adoption, we partnered with some folks at Stanford and other places to write up our experience along these lines. That was published in Health Affairs last year. So what about giving data to patients? I've talked a lot about showing data to patients, but can patients take their data and then use it? And the idea there is that you want to put the patient in control. And the 21st Century Cures Act really kind of mandates this. And I'll talk a little bit about the end game in May of 2022 in a moment. But we had been in talks with Apple at around the same time in 2017 to install the Apple Health Records platform on UCSD's MyChart, and that was done. And what this does is this allows patients to extract discrete data, things like immunizations and medications and lab results and so on, into the Apple Health Records platform itself. So it's no longer in MyChart, it's no longer within our electronic medical record. The patient has a copy of discrete data elements of their health information. We are currently working with a group called Common Health. This is the equivalent construct on the Android mobile platform for patients who don't use iPhones to be able to do the same thing. And we expect to have that in place fairly soon. Now, sometimes patients don't really want to have their discrete data, but they are seen in multiple healthcare organizations, and they want to be able to show their doctors information from UCSD, and maybe that other place they're seeing doesn't use Epic, and so standard Epic interoperability platforms aren't available, or they're not within our affiliate network. And so, well, the patient is then the conduit of interoperability. And so we have turned on something called Share Everywhere. This is something that allows patients to give a physician outside of UCSD a one-time link that's time limited, but they give that link, a web link, to a provider outside of UCSD, and that provider can then get a view-only version of all of the electronic health information for that patient. They can see their prior appointments and notes, lab results, and all that kind of thing for context. This is a lot easier than extracting a PDF and having the patient send that. It's very, very convenient, and it also lessens the burden on the outside physician because they're not given a bunch of paper or an electronic file that they have to determine whether they need to store locally. Oftentimes, the outside physician just needs to check a few things or validate some information, and having this one-time view-only link serves that purpose. So the Apple Health Records experience was very interesting, and this was before the 21st Century Cures Act details were known from the ONC. And I think Apple was really the first to conceive of the idea that patients would want to have their own information in a way they could control, and in a way that they would be able to put other third-party apps on top of that data to do whatever they wish. And so we wanted to be very early on this because we thought it had great potential. So we worked with Apple, and we were one of the first 12 health systems in the nation to pilot this Apple Health Records product. And we were the first healthcare system in the University of California to do so. All 5 UC Health sites now do that. We went live in 2018. This uses standard application programming interfaces, APIs, so that patients can extract their discrete health information. And you can see some example screenshots here of the Health Records app in an iOS device. You can see allergies, vitals, diagnoses, immunizations, lab results, and so on. And again, the idea is that patients could then use other mobile apps on top of that data and marry it with perhaps their exercise data or nutritional data that they're putting in other things to derive insights about their own healthcare. We did survey some of our patients that adopted this early on. We got an extremely positive response. I will say it's probably skewed because the people that adopt this are people that are relatively techie and they like it. But we did write up a brief article, and we got this published in the Journal of the American Medical Association in January of last year. And what we theorized is that this had been tried before. There was Google Health and other things like that that really fell by the wayside, in terms of personal medical record on a mobile device or even on a computer in general. And we thought that the reason that this would work better now is the ubiquity of smartphones is what is new. Everybody has a mobile device, almost everybody has a mobile device. And so the platform is now ready to do this kind of thing. Internet and Wi-Fi connectivity is much better than it was in years past, and we'll see. So we've had thousands of patients download this. We don't really have the ability to find out what patients are doing with it without an additional follow-up survey and a research project, and we are considering doing that. So what are we going to do next? We put a lot of data in front of patients, but we're not done, and there are other things we can do. A project that is nearing completion is allowing patients to see the actual radiology images in MyChart, not just the narrative results, which they can see today. And we think that'll be done fairly early in calendar year 2021. As I said, we want to replicate the Apple Health experience for our patients that have Android devices, and that is almost done. We've shared a lot of notes with patients in MyChart. We're not yet sharing notes in the inpatient portal on those iPads at the bedside, and that is something that we're working through with the relevant stakeholders, and we hope to be able to bring that live in calendar year 2021 so that patients can see their inpatient notes in relatively real time and engage with their physicians. And finally, one of the concepts that's been out there for about a year, year and a half, is the idea that patients would move from just a recipient of information to a collaborator with the physician, from having open notes to an actual co-author of their clinic notes. You know, patients are bringing complaints and concerns and raising issues in the context of interacting with their physicians, and that is part of what we as physicians document. Why not have the patient document that content directly and take burden off of the provider? This is called Our Notes, and we're hoping to get a pilot for this launched and up and running next year. So just to sum up, we've always been very much in favor in terms of getting data in front of patients. We think it is essential to the patient experience and the ability for them to engage in their care. This has just been a summary of our strategies over the last 3 or 4 years to do that. And the last thing I'll mention is that under the 21st Century Cures Act, just to bring it all back around, the patients get a right in May of 2022 to be able to access all of their electronic health information, not just notes, not just results, everything in the system. This is an interesting concept because there's a lot of stuff we put in the electronic medical record that a lot of people don't consider clinical and is not part of our policy-defined legal medical record. And so this is a discussion that I think will be very interesting during 2021, both in terms of what it means, how that data is defined, and it's a lot of work, frankly, for the electronic health record vendors themselves to be able to enable this through patient portals like MyChart. So I will stop there and ask if anybody has any questions.
Thank you, Dr. Clay. We greatly appreciate you sharing some of the digital health initiatives you're leading at UC San Diego.